patients who are interested in vaginal rejuvenation laser procedures, I recommended several important concepts for the consultation and treatment selection. Number one is I advise the doctors should do a thorough history and symptom taking, because that will get a full dimension of patient's demands and needs. And that's what we call the patient-oriented consultation. Also, it would help the doctor to understand the patient's expectation better. Second is we recommended to make a total solution treatment plan for your patients, because for most of the patients that they request for those vaginal rejuvenation laser procedure, most of them they are not only targeting on one symptoms. So we try to utilize the procedures and devices on our hand to combine with the Fotona, especially intimate laser procedure, to reach the best satisfaction of the result. Number three is after the procedures, we recommended you have to explain the effects in different ways according to different patients' backgrounds and demands. And that will meet, the first point that we talk about the history and symptom taking and what we call patient-oriented total solution. Because for example, for postpartum cases, most of the postpartum cases just have baby born. So there will be more concern about the loosening and the lack of grasping feelings result from birth canal being trauma and pelvic relaxation. But for some menopause and postmenopausal women, they will take more concern about the dryness and lack of elasticity due to the mucosa atrophy and collagen loss. Pre-procedure and post-procedure care, I recommended the gynecologist doctor or the practitioner should do a manual, thorough pelvic examination target to vagina to check. And it's a little bit different than the usual and routine pelvic examination for gynecologists. Most of the time, I will target on the general vaginal elasticity level, and I will check thoroughly to the anterior wall, posterior wall, and to see if there is any cervix prolapse or any cystocele or rectal seal. Because will help with your diagnosis with the thorough and general vaginal elasticity level. Also, we have to check about this vaginal intoritus, means the openings, to see if there is any trauma caused by birth canal. Also, second thing, we recommended you have to check if there's any acute or chronic inflammation over vulva, vagina, and cervix. Third, we suggest to check if the mucosa is being undergone with the atrophic change, or this orifice if it's so dry and there's an atrophic status of the orifice. Fourth things is for myself, I will specific to check if there's any tenderness or trigger point inside the vagina, because that will probably cause this dyspareunia, means the painful intercourse. If they got a painful intercourse problem, then that would be the first things to block the good sex. So if the patient, while we do the pelvic examination, and you found anything that would trigger or make any tenderness point, I think that is very important. You have to solve this before you started with the laser treatment. Because the intimate laser procedure itself is to improve the sex quality. But before the sex could be performed smoothly, then you have to make the patient, at least they can be comfortable about the sex intercourse to perform without pain. So most of the time, if those patients got dyspareunia problem, means a painful intercourse, I will treat the dyspareunia problem before the procedure. And the procedure I'm using is the prolotherapy injection over trigger and tenderness point. And after several minutes, if the patient feels better about this tenderness, then I will start with the procedure. Then if you apply the speculum, the patient will feel comfortable about the whole procedure. And that will help with the satisfaction and successful rate. And for the post-treatment care, I recommend it. You can treat the chronic inflammation or vaginitis, or like even leukorrhea with like a vaginal suppuratories, means like some medication that you can put into the vagina afterward, or you can put like some medication prescribed or probiotics to treat the leukorrhea and vaginitis. And also we have to follow the patient in the right time with phone calls or text or emails. Because like, sometimes patient might encounter some symptoms or events which are related or unrelated to the laser procedure. So you have to touch up the patient. And the routine in our clinic, we touch up patient in 3 days and also in 4 weeks. Because in 3 days, some patient, they might have like some event, probably not related to the procedure, but they will misunderstand, probably symptoms is related to procedures and get so worried. And the 4 weeks follow-up means like, because that is the effect of the whole procedure that will go to the full effect. So we want to see if the patient is satisfied or they need another treatment. Procedures is actually pretty rare. I have performed over 3,500 cases of intimate lace. Almost no complication have been observed, after the procedure we were ever noticed. But there are actually some possible symptoms would probably happen after the procedure, and that were related to patient satisfaction. So I want to kind of hint it out here. Number one is like the coffee ground discharge for several days after intimate lace. That is due to the chronic cervical erosion or severe vaginal inflammation. And because due to this condition, the mucosa will get relatively very fragile. So if you ever put the speculum inside there, you'll probably get an abrasion, mild wound, from this very fragile cervical erosion or contact bleeding, or caused by this mucosa abrasion. So if you ever notice there's severe cervical erosion and vaginitis while you're doing the procedure, also you will kind of be seen with like a much leukorrhea and redness, over vaginal mucosa. Probably you will want to treat the symptoms first if it is so severe. And then after 1 week or several days later, you will probably want to perform the procedure later. Or you could tell the patients about the possibilities that if she wants the procedure at the same day, and then she could probably, after the coffee ground discharge, after the procedure, and then the patient will feel like a relief and comfort if they had it. And also after the procedure, you have to treat the patient with the oral medication or like a vaginal medications that I mentioned as above. So in that case, patient will feel like no worry and feel like a relief about if the symptoms happen. Second things I want to hint out here is like I want to advise that the practitioners or doctors should control the laser energy given by R11 probe in the cases of menopausal women and postmenopausal patients. Because R11 is the full beam probe of the Fotona air-beam laser platform, and we count on this R11 a lot to create a sufficient heat to tighten the vagina and to arouse the following cell signals to regenerate the collagen. Relatively will give more energy than other probes like PSO3. So when we apply R11 probe, you want to follow the energy guidance by the Fotona company, especially how to be very careful about not to give too many pulses or paths to those postmenopausal women or menopausal women. Because like many doctors, especially for Asian doctors, they will think about probably you will get more energy, then they will get more tightening. But actually it's not safe and it's not correct. And then the collagen there are relatively thinner for those groups. So you have to be very careful about the group I'm mentioning about. The thin and fragile tissue would be less resistant to overheated laser procedures. Also, you want to observe the patient's reaction during the treatment. If the patient feels any signs or pains under certain energy with any probes, then most of the time I will lower down the energy draw and try to still apply and pauses and passes during intimate lace. Because use repeated pauses and pass under safety guidance according to safety merits, you could still generate enough heat to make the result. Okay, so Fotona laser is one of the core platforms in all of my 10 laser centers located in Taiwan or Texas. Fotona Dynamics SP is the platform that I usually choose for my centers. Among many procedures that could have offered from the platform, vaginal rejuvenation lasers procedure and also the facial lifting procedures by the anti-arc laser and the intraoral laser is the most popular procedures I could say in my centers. As for the strategies to develop those procedures, we could summarize some hints as follows. For the vaginal rejuvenation laser center, including intimate lace or incontinent lace, the credit of intimate treatment largely comes from the words of mouth. So most of the time we count on the words of mouth more than 50% of our clients here. And because most of these Asian ladies, they're relatively more conservative. So they will only talk about this problem with their sisters or mother and daughters or very close lady friends. So if you get successful and sufficient effect for those groups, then really just spread it out and talk to their friends and their families about the result. So many of our clients is like when the daughter, gets successful result from the intimate lace, then we'll kind of talk to them about the results for the treating the incontinence. Then they will bring their mom here for the clinic. And sometimes the mom perform these procedures and get so satisfied and bring out the daughter, just have baby here. So I think, based on words of mouth, and you have to make satisfied and result for your patient is so important. Also, I experienced the procedure by myself, and actually I'm the first female doctor in Taiwan to try this intimate lace and incontinent lace from Fotona platform in Taiwan. So I strongly recommend it any doctor if you want to practice in this field. If you are a female, then you have to experience the procedure by yourself. And if you're a male, then you can encourage your family and your spouse to experience the procedure. Also, you can encourage your staff and your friends to have a pleasant and well-satisfied treatment experiences, so that those staff and friends, they will be out of from satisfaction. Then they will kind of be a very good marketing example. Also, you have to educate your patients. For myself, in 2016, I wrote a very special book, and that is toward to the public. And I kind of wrote 13 chapters inside there to explain why, there's 12 different kinds of specific group why they need the vaginal rejuvenation treatment. So that will well explain your whole concept and theory, and while spreading the concept in a thorough ideas. Because most of the patient, they only interview you with 10 minutes or 15 minutes. But we give patient the books, so patient will kind of get more information, knowledge from my book. And also, I got interviewed from many magazines, TV, and also newspapers, and try my best to kind of put right and correct concept and knowledge inside those interview articles. And also not to be afraid to talk about sex or genital complaint with your patient. Because if the doctor himself or herself got the phobia to talk about sex, then you couldn't to create a warm and caring attitude or atmosphere for the consultation and treatment. So we try to create a very relaxed, warm, atmosphere. You can see the surrounding is this consultation room in my clinic. So that is a very relaxed atmosphere that can encourage your patient to talk to you more. Also, we care about the privacy of our patients, so we create a relaxing space and treatment. And also, I think the treatment should be done by a very experienced doctor, because like any woman when be put on the table and to accept the procedure in specific posture, then she wouldn't be feeling very relaxed anyhow. So if this procedure is done by a very experienced doctor, then it can be done in an efficient way. And then second, procedures that I think is very popular and very successful in our clinic is the facial lifting by anti-yaw laser and intraoral laser. In this way, it's like a little bit easier to make a strategy to develop in our practice. I think you can educate your patient with the half-face immediate change after the laser procedure, explain to them in a beauty concept. Because like for those two, lifting and also intraoral laser, you can see a very significant change if you only do half face in the first. So when patients see the half face lifting and half face change, and you got the beauty concept to explain about it, then you can make the patient feel very satisfied in the 1 second. And also you can follow your patient with phone calls and text to create fluent communication with your patient after the treatment. That is what we call, make doctor approachable. And I think that's very important for intimate treatment and also for facial treatment. Also, don't overpromise the effect. That is important for facial and intimate treatment for both, because we explain what could be improved and what could not be improved for the first consultation. So our patient won't have the over expectation for our treatment. Also, we combine other aesthetic injection technique. Like for myself, I combine PRP injection to filling with the depressant on the face to combine with the lifting, and then that can create a very sufficient and good result and make our happy and satisfied patient.
Thank you, Jennifer.
Marketing tool for the laser procedures. I want to especially target on intimate treatment, because that is very different from the aesthetic one. So the marketing tool I recommended for public marketing, I would recommend some social medias. But for some doctors, their article is too difficult and too academic. So for me, I try to write easily understood articles for the public in easy tone. And also, we got interviews by some TV and newspapers and the magazine. And by the same time, you should make the articles and this talking to be very easily understood. And there's a good and free way to marketing yourself. Is like you can do some short video, talk about the procedures, and to put it on the YouTube. Because people get to check on the and Google the doctors on the YouTube a lot recently. So this is good. And also we invite some bloggers or cyber celebrities to experience our procedures, and they will write articles on their blogs or their space to share about it. And one important thing is like we found our patient, some percentage, about 8 to 10%, they have the intention, also interested in our procedures, like they check everything, profile, resume about the doctors. Also, they mention about my profile photo look friendly and warm. So I think you should take more concern and time to do the good profile photos to show the warm and kind feelings. And for the marketing tools inside the clinic or laser centers, I would recommend you can put some posters, brochures, and you can train your staffs that ever experienced the laser and talk to the patients. And I think that is a good marketing tools actually, because that's what they already experienced about it, and then they could talk about it in easy way. And for the marketing tools, I think should avoid is like some of the advertisement that they over exaggerate about the result. That is not good, because that will make the patient lose the kind of feeling of trust. Also, some of this clinic, they linked with the procedure with discount information. That is not good either, because like according to the marketing, discount of the procedures, if the doctor discount the procedure and just want to sell more procedures, it actually won't bring you more patients, especially for intimate treatments. So I think this is very important. But we would do some proper activities, sometimes for Valentine's Day, Mother's Day. I think that's acceptable. Okay, so I can summarize the advantages of Fotona laser as first one is durable. Okay, so I'm pretty satisfied about the durable characteristics. Number two is stable. The meaning for stable is I actually ever tested clinically about this intimalase and this vaginal tightening effect on our patients, especially for Asian ladies, and we found this tightening effect is so stable among all our patients. And that is so important because we don't want it only works on some groups, but it doesn't work on other groups. So the stabilized effect is so important. Third thing is you don't have to buy consumable materials afterwards, and I like it very much. So that gives the doctor many free choices in the future, so that you don't have to pay a lot of cost when you try to marketing these procedures. So I think without or very limited consumable materials is a very important advantage for Fotona laser platform. As the above characteristic like a durable, stable effect, and also without or very limited consumable materials. Also, I want to hint out my favorite system among all Fotona laser. Of course, we got many platforms in our clinic, but my favorite one from Fotona company is Fotona Dynamics SP, because you can develop many procedures that fit in different criteria and fields. Like you can do facial lifting, intraoral laser lightening, black circle, eye bag, snoring, and also you can do all those intimate treatment. And also it can do breast or buttock lifting, body sculpting, so kind of stuff. And based on a single platform, well, close to reality is you can buy a platform and then you can develop many procedures out from that. Means you can sell more and collect the money faster. Okay, that's based on management and business. Also, there are some procedures that you can offer from those platforms. Is for example, for this black circle and eye bag treatment, that is very unique. It's very hard for you to find a very similar procedures on the market to create a similar effect. So for black circle or eye bag, the only way other than this is surgery. So almost you have no competition on the market compared to others. And for snoring treatment, as I know, there's almost none of other non-invasive procedures that can compete with the results that I'm using from the platform now. So the unique characteristic of some procedures is actually very obvious. Also, those procedures are almost painless, and that is really good because I create a high comfort level compared to other lifting procedures from other companies. Well, this I could say is close to none of the painful level. And the resultant effect for those procedures is stabilized and the maintenance is satisfied. So based on those characteristics I'm talking about, I think this is my decision making why I purchased a Fotona laser.